Now, the Australian-New Zealand Intensive Care Society has been having discussions with the Federal Health Department and Chief Medical Officer Brendan Murphy about the sector's response to the coronavirus. Associate Professor Steve McGloughlin from the Society joins us now from Melbourne. Steve, g'day. So first of all, explain for us what your organisation is, because we haven't kind of heard much from it before.
Yeah, thanks very much. So ANZICS, as it's called, is the Australian-New Zealand Intensive Care Society. And it's a group of all the intensive care physicians in Australia, a voluntary organisation that groups us all together as a society and able to help us with our workforce or with clinical guidelines and with assistance in that regard. It also is really important because it maintains a database of all the resources available within the intensive care units in Australia, and also keeps track of the outcomes of all the intensive care units in Australia. So it's a really important role that way.
Yeah, and so what meetings have you been involved in about coronavirus over the last couple of weeks?
Yeah, so look, as soon as this became an issue that we realised we might have to face in Australia, we got together as a group within ANZICS, a group of medical and nursing and other staff, to try and form some guidelines and guidance for our members and for the intensive carers in society, so that we can provide some leadership and also stop replication of work, and so that people can all be on the same page. We were fortunate enough that Chief Medical Officer and other parts of the federal government were really keen that we did this, and were able to support us. And they're also very keen, obviously, for us to be able to coordinate and bring together all the resources of intensive care in Australia and New Zealand, so that it can be all brought together in one place.
And so there's been some concern raised in the last couple of weeks about the capacity of Australia's intensive care units to take on more people. Some people saying they're running at capacity all the time anyway. Take us through what your perspective is on that.
Look, Australia does have a world-leading intensive care hospitals and groups. We do run busy all the time. We'd be a liar not to say that. However, there are things we can do with a graded response such as this. So in the first instance, if we had a few patients, that would be part of our normal work, and we would do our best to look after patients in that regard. But if we ended up needing to look after more patients, either a smaller number or even as the numbers got bigger, there's a lot of plans in place for what we could do to increase capacity. That includes such things as using all the capacity in Australia. There's private and public hospitals. There's abilities to sometimes readjust the priorities for things such as elective surgery and when things could be done and how they would be done. And there's also other parts of hospitals that can be quite safely and efficiently turned into intensive care units if we needed to. And those plans are in place at a federal level and also at individual hospitals levels.
So taking into account what we've seen in the rest of the world with this, are you confident that if there was a substantial outbreak in Australia, that Australia's intensive care facilities would be able to handle the demand?
I think we're as well placed as anyone in the world, if not better placed than just about anywhere. We've got a really strong intensive care society. We've got great links to the emergency departments and the hospitals. And as I said, we can really improve the capacity dramatically. So we could really, not to sound flippant, but we can really hope for the best, but we are truly planning for the worst, even though that's the less likely outcome.
And what is the worst you're planning for?
So we have to plan for the worst, so we won't go into all the detail about that, but we do think about all the places in the hospitals we could look after intensive care patients, both within large hospitals such as the Alfred hospital, or even smaller hospitals, private hospitals, and all the staff that are available. So we really look at maximising the resources, and to give the community confidence, when we do that, there's a lot of capacity we can do to look after a lot of people in Australia if we needed to do that.
And you might not want to go into that, but does that mean that in worst case scenario that there would be like 100,000 extra patients that ICUs would have to take care of over the next, over a 6-month period or something like that?
I guess I've got a lot of faith in the official statistics and modelling that's going on, and they're looking at all sorts of variations over mild, moderate and severe, and different graded over different times, so whether it would come quickly or whether it would come slowly. We are quite used to dealing with, over winter period, for example, large influxes of patients with respiratory illnesses, so we have got some experience at dealing with infective illnesses and big influx, and we've been able to adjust to that and do that very safely in the past. So it could be a large number, but I'll leave that up to people more expert than me in the modelling of that.
What about the special equipment that would be needed to handle a coronavirus outbreak?
So obviously our first priority is to look after the patients, and we've got great access to equipment in Australia, and I know at a federal level and at a state level and individual hospitals are all looking through the equipment they've got now and what we've got immediately available and what could we get access to in a crisis. We also have the ability at a state level and even a federal level to share equipment, which is really important so that other people, wherever it's needed, can be used. The second part of that obviously is looking after our staff, which is really important. So we've got to make sure we've got access to personal protective equipment for the staff and that we use the best advice available. And I know every hospital is doing that really well. And again, that's also getting coordination at a state and federal level. So obviously that's a massive priority for us.
And we had this case just in the last couple of days of a doctor testing positive for coronavirus in Sydney. Has that raised particular concerns for you? We don't know how that has happened yet, how this doctor picked up the virus, but has that raised particular concerns for you about the extent to which there are protection for people who are part of your society?
Obviously, I'm concerned for the individual, but we were already concerned about our staff, so it's already a major priority. And as I said, we, maybe not to the scale if this becomes bigger numbers, but we do look after a lot of people all the time that have severe infective illnesses, and we really take safety of our staff as a really, really top priority. So I'm concerned for the individual, and I'm concerned to learn more about it and what happened, but it already was a really high priority for us all.
Yeah. And what do you make of the way that the World Health Organization has handled this so far? They've been reluctant to declare this a pandemic. Have you been curious about that?
I guess it's hard to know because they're obviously dealing with so many different health systems, so I sort of sympathise with them, the challenges of dealing with different health systems in different countries. I think the Australian response so far is we want to keep a proportionate response, which has been good. And I guess I understand the challenges somewhere like China, where this has come as a new thing, versus other countries that are getting it with warnings, such as we are. So I sympathise with them. I'm not sure the wording that they could pick, you know, who knows if they've picked the right thing, but I do sympathise, and I do, at least we have some sort of world coordinating body. I know we look to the WHO guidelines for things such as personal protective equipment and treatment, so they do provide some assistance that's really helpful to us.
And it seems to be the case, according to official figures, that China is getting on top of this. It seems like there's optimism at some stages and pessimism at the others. Does that give you some degree of hope about the ability of the world to effectively handle this, that it seems to be the case that China's getting on top of it?
It seems that way, doesn't it? They're getting on top of it, so it's better than the other way, isn't it? So I think that's a really impressive effort. We're assuming that's true, and I think that, you know, given the population they have and the challenges they've been faced, if it's true, and it seems to be, then that's a great effort. And as you say, gives us hope that with good coordination and proportionate response, we can do something that would really make a difference.
Yeah. We heard from Brendan Murphy this morning. He's been giving evidence before a parliamentary committee, and the focus for him very much at this stage is still on containment. There's optimism that there are these kind of isolated cases of human-to-human transmission, but containment is the focus at the moment. Does that seem the right approach to you?
I think so. I mean, that was obviously the preferable. We don't want anyone getting sick who doesn't need to get sick. I guess my job and the society, ANZICS, our role is to make sure that if that doesn't work, we have a plan so that the community can have confidence and they get the best care they can. But we're not the best option. The best option is it never happens to begin with.
Okay, Steve McGloughlin, really good to have a chat to you, and good luck with your work in this area over the next couple of months.
Thanks very much.
Steve McGloughlin there from the Australian and New Zealand Intensive Care Society, which will play a key role if this coronavirus outbreak continues to grow significantly. Now,